And I'm going to talk more in just a second about what we mean by smart actions. But before that, I would love to introduce who's going to be talking to you today. So my name is Carrie Sorensen. I'm a family and consumer sciences educator, and I work with University of Maryland Extension. I have the pleasure of working in Frederick County, and I live in Washington County. So I get to hang out in the western part of Maryland right now. I'm joining you from my home, which is very fun and always interesting. So I'm keeping my video off for now since as I said, I'm joining you all from home. And sometimes my connection is good and sometimes it's not great. So I'm going to keep my video off in hopes that keeps anything weird from happening. But if you notice anything strange with the connection, if there's stuff that isn't working for you, go ahead and throw that in the chat. If you see messages coming in from Jesse Ketterman, he is on our team as well. He's running the tech side of things for us this evening. He'll be responding to questions or helping people address technical issues in the chat, letting us know if there are any questions and any of that kind of thing. And I'm going to see if Dorothy would like to introduce herself.
Hey there, I'm Dorothy and I am joining Carrie. I teach in Frederick, Howard, and Montgomery counties. My office is in Ellicott City, but thanks to the wonders of Wi-Fi and the internet, I am joining you from my home also in Baltimore. A little bit all over the place.
Always fun, all over Maryland. And then we've got some folks from other states as well, which is very cool. All right, so having gotten all of that out of the way, we are really excited to be offering this session for you today, and we're hopeful that it's going to help you achieve three things. The first one is understanding how to use your health insurance. The second is learning how to manage healthcare expenses. And the third is identifying tools to help you solve a problem. So we're going to go through what we have kind of termed the SMART actions. There are a set of actions that we've figured out. If you do these things, it helps you be the kind of the best user you can be of your health insurance. And we call that a smart user. So that's the idea here, is that we're going to go through all these actions, make sure you feel comfortable with them, and help you to be a smart user of your health insurance. All right. That's our goal for the session today. And by the end, you're going to let me know whether or not we achieved our goal, hopefully. So why are we talking about smart use? Why is this a big deal? Why does it matter? And really, we're talking about smart use because if we can be smart users of our health insurance, then it can help you manage both your health and your money. So if you could, I'd love it if you could put in the chat what things that you do with your health insurance, how do you think they matter for your health or for your finances? Is there anything that you can see having a big effect on your life and your money when it comes to health insurance? I'll give everyone a couple of seconds, see if anybody has any ideas to put in the chat. All right, so I'll go through some of the things that we've come up with. If you're using your health insurance well, hopefully one of the things that you'll get out of that is that you're healthy enough to work or to attend school or both, whatever it is that goes on in your life. And that's because using our health insurance, research has shown people who use their health insurance as it's designed and get all the services out of it tend to be healthier. And so I think maybe that's one of the things that falls through the cracks sometimes because we get a little bit of focus on maybe the cost of health insurance. But there's a reasoning behind it. And if we use it the way it's designed, hopefully it helps with our health in the long run. It also helps with preventing and managing chronic illnesses. So we can, engage with our doctor, have a relationship with healthcare professionals, and make sure that we're preventing wherever possible, and that if any issues do come up, then we're working with a healthcare professional to manage those kinds of things. Also, We want to get preventive services to keep costs down. If you can intervene early with a healthcare issue and get preventive services to manage it before it happens, then that can be the most cost-effective way of handling a healthcare problem. So those preventive services, we're going to talk more about them, but they're a really important part of the whole healthcare picture. And then also to save money. Um, Hopefully, if we are solid users of our health insurance, if we know how it works, what kinds of things we need to be aware of, then we can make sure that we're using our health insurance in the way that is going to be most financially reasonable for us. And you know, we all know that health insurance isn't by any means cheap for a lot of folks, but hopefully if we can use it in a way that is not going to make these ridiculous, you know, unexpected expenses pop up all the time. And then again, with that financial piece, to avoid costly problems. Hopefully we're in a position where we can make sure that we're not having these kind of expensive healthcare issues come up. So that's a little bit of the basics of it. I want to play a short video for you guys and see if this resonates for anyone. So we're going to play this and just ask yourself this question that's at the top. Have you ever felt like this?
This is a POS and not a PPO.
A PPO?
It's a POS.
I want a POS or I have a POS?
You have a POS.
So you want me to have a PPO?
You have a POS and not a PPO. That means
I want a PPO?
you have a POS. It's like an HMO. It means you need a referral from a PCP.
PCP?
A primary care physician.
A POS means I need a PCP?
A referral.
Find a doctor in your network before you.
So if that rings bells for anyone, I know that the first time I watched it, it made a lot of sense to me. And kind of what's happening in that scene there is that mom is trying really hard to get, you know, someone to provide healthcare for her child, and she's kind of having all this alphabet soup thrown at her, right? Where we're seeing all of these terms get thrown into the mix. Do you have this kind of plan or that kind of plan? What kind of referral did you need to have? Did you need to see a doctor before you came in to see the person today? And so that really drives home a point that we found when we were doing research that before this program was initially developed. And what we heard from a lot of folks is the most stressful part about health insurance is the terminology. There are just so many words that only come up when you're talking about health insurance, and it's just really difficult to figure out what anybody is talking about, and it adds so much stress to the situation. So as we go through this session today, we're going to talk about some different terms. We're going to identify some terms that are important, but I also want to point out that we went through and created what we call our important words to know document. And so what we did was use some really common health insurance terms that are, I think most of the terms came from healthcare.gov. And we went through and tried to define them in a much more user-friendly way. And so, yes, thank you, Jesse. Jesse just put a link in the chat to our words to know document. If you click on that, it'll take you to a PDF. And those terms are really, really helpful because they give you as short as we could. Some things are shorter than others. The terms are a little bit complex, but what we tried to do was define common health insurance words in the simplest, most user-friendly way that we could, so that if you are dealing with a health insurance issue, you have a reference guide to go back to and say, okay, wait, what are they talking about here? What does this word mean? Dorothy says that you also have that in an email that was sent out earlier today. So you can either click the link here or you might have it in your email. You should have it in your email. All right, so what we're going to do now is just do a quick activity with our important words to know and see how comfortable you guys feel with some of the terms that we're going to be talking about later in the presentation. So what I'm going to do is start a poll. And I think that's up and running. Hopefully you guys are seeing the poll questions. If you're not, let us know in chat. There are 5 definitions, and then with each definition, there's 4 options for the term that goes along with that definition. So you can read through it and then see which one you think is the right one. and then we'll go through and talk about each of them. I'm going to give everybody just a few minutes to go through and answer. And this is just to see how well we know some common health insurance terms. Your name won't pop up with your answers or anything like that. This is just to see what this group knows off the top of their heads.
Yes, the responses are anonymous, and you do need to scroll down to get to them all.
All right, we have answers from just about everybody, so I'm going to leave it open for just another maybe 30 seconds, and then we will see what we all came up with. So the first one was the network, and we're going to talk about that in just a minute, a little bit more in depth. That one is really tricky because usually your primary care physician is like the most important in-network doctor for you. Essential health benefits, that was one that you guys were really familiar with. Number 3 was one that was split between evidence of coverage and explanation of benefits. We're going to talk about that a little bit more. Evidence of coverage is the one that is the contract between you and your provider. Explanation of benefits is what you get in the mail after you've had a service, and it kind of describes what was covered, what wasn't, how much you have to pay. We'll talk about that more too. Preventive services, that one you guys got perfectly. Excellent work. And out-of-pocket costs too. So for the majority of the questions, you guys did a really, really great job. But hopefully you can see how not knowing some of these things would make it that much more complicated to try and deal with questions or problems or even just going to the doctor. Okay, so built into the rest of what we're going to do today is focusing on making sure that when we bring up a health insurance term, we talk about it a little bit and make sure that it's something that makes sense to you. So as we go along, if we bring something up and we don't do that, let us know. Say, hey, you just threw a word out there. Go back. Tell me what that one means. And we will be absolutely happy to do that. All right. So for our first smart action, I'm going to turn things over to Dorothy.
Thank you, Carrie. I am going to talk about the first couple actions. There are several actions we're going to discuss today. So I'm going to start talking about a few. I've got another poll for you. Let's see, let me find it here. There's a couple questions here. How many of you own a smartphone? And then you're pretty confident that you're making full use of all the features and technological advantages that the cell phone offers. Okay, so it looks like all of us pretty much own a cell phone, smartphone, and probably not using everything that it offers, but using a fair amount of it. So I asked that for a reason. I'm going to close this. Because health insurance is often the same way. A lot of us have health insurance or we're thinking about buying it because it's helpful, as Carrie mentioned, to maintain our health, but also to protect our finances. But often there's a lot to it, and maybe we're not taking advantages of all the benefits that it offers. So we are going to talk about some actions that will help you to take advantage as much as possible of everything that your insurance policy offers, because it's not cheap. Insurance can be expensive, so it might as well get all of the full benefits out of it. So the first action that we're going to talk about is to know what the health insurance policy covers. What's out there, what does it cover? So why is it important to know what a health insurance policy covers? It's important to know what our covered services and benefits are, and we'll talk more specifically about that in a moment. To understand the plan costs, because different plans have different costs, there are different elements to the costs, and knowing what those costs are will help us with our financial planning. And to know how to find in-network doctors and facilities. Those were some of the definitions that we talked about, knowing who your in-network primary care physician is, as well as your other in-network doctors, and also in-network hospitals. And there are times when a hospital might be in your network, but some of the physicians who work there are not, so it can be very confusing. And then we'll talk about knowing how to dispute a billing error. So knowing what your health insurance policy covers will also help to understand how to dispute a billing error. So what exactly does your health insurance cover? If you have obtained your insurance through either the health insurance marketplace or through most employer plans, under the Affordable Care Act, your insurance plan, your insurance policy has to cover the essential health benefits. And what are the essential health benefits? They are a group of 10 categories of coverage, and you can see them on your screen, that have to be included in all insurance policies. There are some exceptions, but everything on the marketplace and almost all employer plans cover all of these 10 essential health benefits. As we look at the screen from the left, the first item in the list is preventative and wellness visits. And that's huge. Those includes things like your well patient visits, immunizations, and other things that can not only keep you healthy, but help you to stay healthy. So a lot of preventative benefits and knowledge of that has been really important recently under COVID. Knowing what's included in the health plan and knowing that you're covered for preventative visits has given people some peace of mind. So lab tests, hospitalization, prescription drug services, outpatient and maternity care, newborn care, certain mental and behavioral health, pediatric care, and also emergency room services are all part of your essential health benefits. Now, it does not, unfortunately, mean they're all free. And that's part of knowing what your health insurance policy covers. Some of these are available at no cost, especially some of the preventative and wellness visits. So there are costs involved, but it's still covered under your insurance policy. So it costs you less than if it wasn't covered. So how do you know this? How do you know what's covered? And the most important document is your evidence of coverage. This was also mentioned earlier in the important words to know. The evidence of coverage is a document, it's your contract basically between you and your insurance company. Now mine it's a little over 100 pages long, so it's not easy reading, but there's a great table of contents in it. I get the hard copy. Sometimes they're available online, sometimes you get the hard copy, but most policies you should be able to request the hard copy if you so choose, or you can just go to the company's website and see it there. But the evidence of coverage will list everything from what's covered, what are the deductibles and out-of-pocket costs for your policy, how do you find out if a physician or healthcare provider is in network. So just about everything you need to know is in that evidence of coverage, and usually it's reissued once a year because it's updated. Another action, well, I'll move on to the next action. Another smart action for using your health insurance is to have proof of insurance at all times. And there are many reasons for that. You never know exactly when you might need it, but it is important. For one thing, it gives your health provider access to all of your policy information. It's why when you go see a doctor or sometimes a pharmacist, they ask to see your health insurance card. It has your policy information on it. They can contact your policy provider if there's any questions or concerns. Your health insurance card lists your co-payments for your medical services. It usually provides contact information to answer questions. And I think I've already given away this question, where do you find this information? And it is on your health insurance card. This is just a sample card on the computer screen, but your insurance card should have all of this general information on it. The plan type, your name, the member name and identification number. If you're part of a group, that number is on the card. But as you can see in number 5 toward the bottom right, it will list your deductibles, your co-payments, and important information like that that you need to know, as well as the contact information for the insurance company. So it has a lot of important information on it, and it's good to carry it with you because sometimes you just never know when you might need it. The third smart action I'm going to talk to you about is to choose in-network doctors. So we talked about how your evidence of coverage will mention the fact that there's certain in-network doctors that you can choose. So it's important to specifically choose them. So an in-network doctor is defined as the providers, the facilities, health suppliers that your health insurance company has contracted with. These in-network doctors or facilities have an agreement with your health insurance company to provide services to you at a covered cost. So not every provider is going to be part of your network, and going to a doctor or provider that's outside of your network can end up costing you a lot of extra money and result in surprise costs on your health insurance bills. So it's important to know that and to advocate for yourself and make sure that the physician that you're seeing or the health care provider that you're seeing are in fact in your network. So with that, I think I've covered this. The insurance company's website, doctor's offices can also help you to determine whether the provider that you're seeing is in your network. So with that, I'm going to turn it back over to Carrie.
Thank you, Dorothy. And I'm going to pick up with our next smart action. So those were we were kind of talking about all the things that you kind of have to do before you even get in the door to the doctor's office, right? Know what your plan covers, make sure you're in network, carry your card with you at all times. The next one that we have kind of starts with, all right, you've got all that under control, and then you actually start using your insurance. And what's a next good step? So you've got your in-network doctor, and a great next step is to use preventive services. Dorothy talked about that a little bit under our things that are covered under our health insurance plan, but I want to talk a little bit more about why it's so important to use preventive services. And hopefully this makes sense, but preventive services, just like it says in the name, help to prevent illness. So the idea is to use things like mammography, blood pressure screening, testing to see if maybe you're pre-diabetic. That's like oral glucose tolerance testing and that kind of thing. All these different screening tools that we use are all about catching someone before they have an illness going on and making sure that your healthcare provider is on top of anything that might not be going super great at the moment. As Dorothy mentioned, a really awesome thing about preventive services that under the Affordable Care Act, there's no additional cost for it, and they've got to be covered services. And more often than not, preventive services are required to be provided at no out-of-pocket cost to you, especially things like your regular checkup, getting vaccinations and screenings and those kind of things. More often than not, those are not things you have to pay for. They really make sure that you stay healthy, that whatever's going on, if things are going well, then you keep going down that path. And so how do you figure out what to do with preventive services? How do you figure out what's covered? The main source that I would go to is my insurance company. So there are some rules about what's required under the Affordable Care Act, and you can find that information at healthcare.gov. But some insurance companies have chosen to go a little bit further. So you may find that there are rules on healthcare.gov that say this is everything that's got to be covered, but your insurance company might cover some additional services that help even more. Some insurance companies are helping people pay for gym memberships, see a dietitian, do some of these lifestyle things that we've discovered in more recent years are really important for maintaining health in the long term. And a lot of the time, people don't hear about these kinds of things unless they're sort of digging around on their health insurance company's website, or maybe they get health insurance through work and they hear about it through their representative at their office. But starting with your health insurance company can be a great place to figure out what are your preventive services and how do you go about taking advantage of them. Our next smart action is to track healthcare expenses. And I know that sounds a little weird. We've been talking about all of these really great health actions, and now we're talking about, tracking our expenses. But the reason that this is important is, kind of our number one is making sure that your medical bills are right. You want to make sure that you're not paying for services you didn't receive, and that if you receive a service, your insurance company is paying what they agreed to pay when you signed up. Research tells us that between 30 and 80% of all health insurance bills have some kind of error. And the reason that range is so big is because different studies kind of give us different results. But what it tells us is there is a pretty high amount of error going on in medical billing. And so keeping track of your healthcare expenses can be a really important step in making sure that you're catching any of those errors that come up. Another really important reason to keep track of these things is because it can prevent medical identity theft. I'm not sure if this is something that you've heard too much about, but what some people will find is all of a sudden they're getting bills or information from their health insurance company saying, hey, you've met your deductible. And they're thinking, I haven't been to the doctor. I don't know how I would have met my deductible already. And so these healthcare papers that you're getting and these kind of expense documents can be the first step to keeping track of someone else using your medical and identity information to get medical care under your insurance coverage. Now, that's not ridiculously common, but it does happen, and it is important to make sure you're paying attention to. Another thing is to have proof of the services that you receive. This comes up especially again with resolving any sort of disputes with your insurance company. So sometimes they will say like maybe, well, we're not going to cover that service because there's some other testing that you should have had done first and you didn't. And if you have records of what's been going on, then you can say, well, it may not be in your system, but I did have that done. So keeping track of those things can be really important for having proof of what kinds of medical services you've been receiving. And then plan for the next year. And we're going to talk about that a little bit more in depth in the next section. But when we're talking about tracking our healthcare expenses, how do we do that? And unfortunately, you need a lot of different documents to pull together. The first one is going to be an explanation of benefits. I know that's a little bit small, but that's the document that you're looking at there. And what happens is when you go to the doctor, you get a covered service. Usually you get, and you might get it via email or mail, depending on your preferences, but you get some sort of documentation saying, this is who you saw, this is what happened, this is how much they charged, this is how much the insurance company paid them, this is how much you're responsible for paying. So it's a really important document because it breaks down all of that information. So explanation of benefits, that's a really important document to keep track of when we're tracking our healthcare expenses. You might want to also keep receipts. So if we go to the doctor's office and you pay a copay, usually they give you a receipt. So you might want to keep track of that. If you have an HSA or an FSA and you've got to keep track of receipts like from the grocery store if you were buying over-the-counter medication so that you can get reimbursed out of your account, you'd want to keep those kinds of things as well. So those are all different types of documentation that we would want to keep when it comes to tracking our healthcare expenses. Once you're keeping all those things, then we kind of have to figure out how to make sure you can find it all again, right? For some folks, maybe you have a binder, maybe you have a spreadsheet. I'm a big believer in the fact that organization is a very personal thing. So you have your system that works well for you, and that might not be the same as my system that works well for me, but whatever works for you to make sure that you can easily find the documents that you need. Those explanation of benefits documents, your evidence of coverage, your receipts from when you've gone to the doctor's office, all those kinds of things are great things to hang on to and keep in a place that's well labeled. So I mentioned this when I said one of the reasons to track your healthcare expenses is to plan for next year. Our next smart action is estimating healthcare costs going forward. So if you've tracked your expenses, it's just like creating a budget, right? We track our expenses and then we can use that to figure out what it is that we actually pay out every month. So if you're tracking your healthcare expenses, then you can get a really good idea of how much you actually spend in different areas of healthcare. And the reason that that's important is because if you are estimating your future healthcare costs, then you have a better idea about how much money you might need to have saved to cover these things out of pocket. It can also be really important if you have, again, an HSA or an FSA, because usually you've got to figure out how much you want to set aside in those accounts. And tracking your healthcare expenses and then estimating can help you figure out how to make sure you're putting the right amount into those accounts and not carrying either too much or too little. Again, it helps you to be able to pay for the healthcare services that you need. If you've got a plan for how much you expect to spend on healthcare in the coming year, then hopefully you can be a little bit more prepared for those expenses. And what we know from research is that when people don't feel prepared or they don't feel capable of covering healthcare expenses, then they will maybe not get a prescription filled. They might skip an appointment with a doctor. And so planning for your healthcare expenses and estimating them going forward can help you get healthy and stay healthy because you feel comfortable with your ability to pay for those costs that you know are going to be coming up. So if you're estimating your healthcare costs, where are you going to find the information? The explanation of benefits, again, is a great one to keep track of because it's going to have that breakdown of exactly what it is that you're having to pay for different services. Medical receipts, again, those co-payment receipts and things like that. And medical receipts can also be, buying medical equipment or things that you might have to do again. And then credit card statements or any documents that go along with a flexible spending account or a health savings account, FSA or an HSA. So keeping track of all of that information is how you'll be able to pull together how much you're spending on healthcare in any given year. And then you can use a tool that we have created. So this is called Helping You Make a Good Guess for Out-of-Pocket Costs. It is on our website. We're going to be sharing a link to our website at the end of our session here. But on our website, you can find this document and it goes through, it helps you figure out exactly what all of these different costs are for you. And then it helps you kind of plan for the next year, and that when it says total, and then it gives you that blank and it tells you to multiply it by 1.05. That's because it's adjusting for inflation a little bit. So it helps you make a good guess for the coming year, even accounting for the fact that typically things get a little bit more expensive from year to year. So hopefully that makes sense. And this is a really great tool. It's one that you can download and fill out for yourself. And the guide that goes along with it really helps you figure out exactly what costs go into each area, and it walks you through it step by step. If you have more questions about healthcare costs and estimating healthcare costs, we have another session of our healthcare programming that we're doing next Tuesday. And so we'll be going through healthcare costs and talking about exactly how we find our cost information, how we plan all that out, how we can plan for our fixed and flexible healthcare costs. So we'll be talking about that more next week. So our final smart action is to use tools to solve a problem. I mentioned a couple of times when I was talking about tracking healthcare expenses that one of the reasons is because you have to be able to identify potential issues with billing. And I was thinking about this earlier today, and I was thinking about what if that was all we did was just get the bill and say, oh, there's an error there. And then you just kind of like give yourself a pat on the back. Good job, me. I figured that out. No, our next step then, right, once we've noticed an error is to try and get it resolved. And that means working with the health insurance company and filing a dispute usually. And why is that so important? So we're talking about, using tools to solve a problem. The tools that we've talked about through the course of this whole thing can be really important to help you solve billing errors. And so if you feel confident in saying, I have all of this information, I know what my policy covers, so I know this service should have been covered, so you were wrong in sending me a bill for it, feeling comfortable with all that information can be a really big first step to then working with the insurance company and saying, hey, you made a mistake and I'd like you to, correct it so that I'm not being asked to pay for something I shouldn't pay for. You want to make sure that the insurance company pays for covered services in your policy. If you are paying your health insurance, like Dorothy said, if we have a cell phone and we have all these different services, hopefully we kind of use all of them if they're things that we're paying for. I kind of think of it like a gym membership. If you're paying for a really expensive gym membership because it comes with a sauna and a juice bar and all these different things, and the only thing we ever do is go in and walk on the treadmill, then maybe we're paying for a gym that's too expensive and doesn't meet our needs. So we want to make sure that the insurance company is paying for the things they're required to pay for. And then also to be able to get quick responses, especially in emergency situations. So you want to know what the tools are that you have available to you to be able to work with your insurance company and get resolutions on the things that you need resolved quickly. All right. So what are these tools? I keep talking about using tools to solve a problem. What are they? A huge one is the evidence of coverage. The evidence of coverage is the one that's going to give you the information about what your insurance company has agreed to provide you under the terms of your policy. It's also going to give you some information about under what circumstances they're required to cover it. So you can look through that and see where it says, if you're in network, they are required to pay, whatever percentage of a covered service. So that can be a really important tool. Medical bills, so things that you get sent to you because they're the documentation of, what you're being charged for. In some states and in some places, you can get in-person assistance. In some states, we call that a navigator, which is a person who you can talk to about health insurance issues. Not everywhere is going to have that. You can also call your health insurance company. I know they don't always have a reputation as being the most forthcoming and helpful, but a lot of the time, whether we love it or don't love it, they're the people we've got to work with to get problems solved. So like I mentioned, the navigators or assisters can be someone who helps you and your insurance company. Those are sort of our two in-person assistance options, right? We might go to the navigator or we might go to the insurance company. You can also contact your local extension agent. Dorothy and I's contact information, we were both listed on there. On our website, we also have a contact us portion where you can let us know if you have a question, if you are part of an organization and you think, man, this would be great for other people that I work with to get this information, you can always reach out to us and let us know that you've had some kind of issue or you're trying to solve a problem and you need a little bit more assistance. We're happy to help with that kind of thing. So we have actually been through all of our SMART actions, and it is now time for me to turn it over to Dorothy so she can take us through a review.
Okay, so now we have a little chance for some audience participation here. We are going to read a story about Casey. This was emailed earlier, but just in case you don't have it or didn't see it, I'm going to put it on the screen for you here. So give you a moment or two to look this over and then we'll read through it and then get a chance to pick out which of the actions we just talked about Casey actually did. All right, so I'm going to read through this and follow with me, and then we'll pick out the actions from what we discussed earlier in this program today. So recently, Casey got information at work that the company was switching to a new health insurance company. After enrolling in the new plan, Casey got the evidence of coverage and the insurance card in the mail. Casey looked over the evidence of coverage and put the insurance card in a wallet, making sure to always have it. Casey saw that primary and preventative care was still going to be covered under the new plan. Then Casey called the current primary care office and let them know about the change in insurance. The office told Casey they are still an in-network provider for the insurance, so Casey would not need to get a new doctor. They also helped Casey get scheduled for an annual checkup. Casey went to that appointment, saw the doctor, and got a flu shot. Casey also paid the $30 copay. It was not a surprise. Casey had budgeted after seeing the copay amount in the evidence of coverage. After a week, Casey got a bill for $400. Casey was confused because the evidence of coverage stated that annual visits were fully covered as preventive services. Casey knew there was a number on the card where customers could call and dispute billing. Casey called the insurance company to dispute the bill, making sure to keep records of any claim numbers, call dates, and other relevant information. After a few calls back and forth, the claim was resolved and Casey's appointment cost was covered by insurance. So now we get a chance to go through this a little bit. Either in the chat box or just unmute yourself and call it out. What are some of the actions from the case in front of you that Casey took? What are some of the SMART actions Casey took? Yes, called the primary care office, contact the insurance company, looked over the evidence of coverage, so didn't just toss it when it came in the mail. Yes, put the insurance card in the wallet. So reviewed the bill, yeah. So let's mark a couple of these in here. So here we go. So the first thing Casey did was look over the evidence of coverage. Someone mentioned that already. Put the insurance card in the wallet. They called the primary care office to let them know about the change. All these have been mentioned. And Casey also made sure that the physician was still a network, because sometimes that can change. Sometimes between plan years, the insurance company might change their contracts and a provider may not work any longer. So it is really important to follow that. Casey scheduled the annual checkup, so took advantage of the services that were offered for preventative care, got the flu shot. Budgeted for the cost, estimated and budgeted the costs, reviewed the bill. That wasn't a really good way to underline it, so I just did it this way. So they got the bill and was confused, so that's evidence that the bill was reviewed. Had the card, so saw that the number was there. Kept the records, the health insurance records and medical care records. So Casey did all of the actions that we had discussed today. So as a review, the actions to take, the actual action steps are to review the evidence of coverage. So it doesn't necessarily mean that you have to read it from cover to cover, but knowing what services you might need in the upcoming year, review the evidence of coverage, make sure that your physicians are still in network, know where things are in the booklet, and have a good idea of what the deductibles and co-payments are. Carry the health insurance card at all times. Use those preventative services to stay healthy. You're paying for them. They're part of health insurance plans for a reason. It's really a win-win situation. So preventative services are part of the health insurance plan so that you stay healthy, and that saves the insurance company money. And when we all spend less on our health, that is good for just our nation's health. It saves the cost of insurance, keeps the insurance costs a little bit lower, and keeps us healthier and saves us money. Use in-network physicians and facilities. Plan ahead for healthcare costs, and that is the program that we have next week, Understanding and Estimating Healthcare Costs. And then track the expenses that we have and use the tools that are provided to save problems. This is the conclusion of our program. Questions from the program today? Here is our contact information, Carrie's and my own. So if you do have a question that occurs to you later, feel free to get in touch with us.